Okay. Hi there again.
Mhm.
Wow, that's a fascinating discussion. Thank you for that. Um, Having grown up in the age of psychedelics. Um,
Right.
yeah. When you were talking to Shraddhananda about the fascial lesions in
Uh,
her bronchioles and stuff,
uh,
I personally I have a spot that's sort of like where I think it's pretty much where my diaphragm and my ribs connect.
okay.
It's it's a spot that has been hurting when I lie down on my back. It's been hurting for like 20 years.
Right side or left side?
My left side, and it's like halfway between my spine and the outside of my torso. And it's sort of right inside. It's not, on the surface. And I'm just wondering if, there's probably fascial lesions there to try and break that up, um, using helichrysum for that.
For
Like,
for that, I would like because it feels a little bit more like skeletal muscle or like in the skeletal muscle, smooth muscle area.
it's so hard for me to say. All I know is that when I lie down and my muscles start to soften, that's when it starts to hurt. It's almost like my muscles tighten around it, and it doesn't hurt. And then when I lie down on my back, it's like this some pretty acute pain, which I try to just soften around so that I can actually keep lying on my back. It's mostly during my yoga practice. Um, and it's been diagnosed in different ways, like that the tendon was falling off the rib or pulling off the rib. And then recently somebody said it's probably, there's a psychological component, but that it's the fascia has created such a tight web around it, and that's why I thought of when you
It's
talk.
close to the ribs though, or is it deeper?
It's oh man, see, it's like right inside. It's like it could be close to the ribs, but deeper. I'm not
Okay,
describing.
no, I get you. So, does it hurt when you inhale? Like when you're laying down and it starts to flare up and you take a big, long, slow, deep breath, does it hurt?
It can hurt when I inhale, but it hurts if I just move, at that point.
And
And
it's a sharp pain.
yeah, it's pretty sharp.
That sounds like intercostal neuralgia. Like you can get it from all kinds of things. Like sometimes it can be because like a rib is maybe just slightly out of place, but it could happen like with a coughing spat or exertion, lifting something, excessive heavy breathing, like an exercise or something like that. And those little nerves can get irritated, and then it easily could just not go away. Like it's like having like a stiff shoulder, but between the ribs,
Mhm.
and so that you're having pain, like you said, when you're laying down and relaxing and the muscles start to soften up, that's changing the dynamic of the rib cage, and that you have a little bit of pain with the inhalation. um, those are usually indicators for intercostal neuralgia, and that even somebody diagnosed it that the tendon, is something with the rib cage. Again, that tells me it's like kind of in that same little area. um, uh, I would treat it with, I would rotate a couple of things. um, like I'm just gonna like think this out with you, right? Like three things that I would say is, one, you want to calm down the nerve, right? The sensory nerve, and so things like vetiver or sage can be helpful in that. It's not going to make it go away,
Mhm.
but it would calm it down. I would actually even look at there's that blend Nerve Help.
Uh-huh.
It's very good for calming down the nerve and re-educating the nerve. So I would use like probably even put it on neat in the area, like just cover a bigger area than what's right there. But like if these are the ribs like this, you're kind of almost want to take your finger and stroke in between the ribs in that area just a little bit, not hard. Like you're just kind of, because feel almost like sometimes like you can feel like the inflamed nerve endings. They almost feel like little like BBs or something that will kind of move around.
Mhm.
And it's an inflammation that's in there that you can feel or not, it doesn't matter. But so I would use that, and then I would use something to move the lymph, so bay laurel, lymphatic blend, chakra root cleanser, anything that just moves some lymph in there, just like kind of detox it a little bit. And then I would use, and these all don't have to be in the same session. You can just rotate them like through the day, through the week.
Mhm.
And then something specific for calming down the nerve pain itself, knocking out the nerve inflammation, the nerve pain. So that pain relief, neuropathic, peppermint, corn mint, anything minty is always kind of good for nerve pain. Yeah, like I'd probably stick in that realm, like pain relief, neuropathic, or like peppermint, corn mint, spearmint, something like that.
And just putting these on.
Yeah, you could put that on with a little lotion, or even that if you can handle it. I put it just a few drops in topically in a neat application, and then rub it in the area, and then just keep rotating between all of those. I mean, at some point, I'd probably work in something for like spasms in that area. Yeah, I say spasms, but I think we're probably leaning more towards like a contracture. So I go back to like that nerve help would probably help that. Vetiver by itself, like that unwind blend. We had that in
Yeah, I have it.
yeah, you could rub some of that on there. Even like spikenard and valerian are really good for muscle imbalances and for contractures. And contracture is different than a spasm. Contracture is there's no neurological reason why the spasm is there.
Mhm.
So that being said, it's usually because something's out of place, there's a misalignment, there's a rotation, there was excessive stress on that particular area. So here with the rib cage, there could have been at some point excessive respiration, like breathing really hard, and went into a spasm and just never went out of it. And those things can go on forever. Like they just, you know, they don't know, like it's been a week, I should probably unwind, and so it's antispasmodic, but it's not so much that it's antispasmodic, it's more about that it reduces the contracture. And sometimes with the rib cage like that, those contractures can be an issue, like the thoracic cage, the rib cage, the tendency is we get little spots on the I keep saying thoracic cage, sorry, the rib cage. We'll get like little spots that they get, like you said, like those fascial lesions, where you'll have full expansion except in this spot, or except in the spot over here, or except a spot in the back, and so it expands except in those areas. So then it starts to limit the chest expansion, and so go through and just even treat some of the rib cage like that actually can be very, very helpful. On athletes, I used to do a thing where when we weren't having any issues like this, is I would use very soft forms of thyme, like thyme linalool, thyme thiolinol, and we'd do a thing where we'd cover the rib cage, especially the front and the sides. The back, you're starting to have to go through back muscles, but to increase the circulation in those muscles between the ribs, just so that they are able to function better, like they're able to expand more and contract more. Because it's like, if you think about like you favor a hip or something and all of a sudden there's a contraction, you're not getting the full extension or the full contraction to move that joint, and then pretty soon those muscles just kind of like harden, like they're still muscle, but they really start to lose their movement, and in that they'll start to be painful. And so you see that the body does this to like prevent injury in like a joint or something like this. It can definitely do that in ribs, like the nerve got irritated, it tightened up, and they almost like start to function like bones, where you're just supporting body weight, you're supporting like structure, you're protecting a particular part of the body, but there's not quite the movement there. And so I would say let's clean that up so that the pain reduces, and then even do like a kind of treatment where we open up the rib cage for you a little bit.
Mhm. Okay.
We were just actually talking about last night, we were talking about like classes coming up, and I was like, how we've done the regeneration for the immune system and things like that. It's like we need to do that for the respiratory system with all the COVID stuff, where we just go through and just break down all the pieces of the respiratory tract and the rib cage and all of that, and just have like a therapy weekend where we unwind that. And so that would be in the vein of that, where you're trying to open up those muscles of those rib cage they're called the intercostals. You're trying to open up the intercostals, and nobody ever thinks about them. Like it's there's these little tiny muscles that are always active because of your inhalation, exhalation, and when they stop functioning right or start to have pain, man, I've been there. Oh man, I had an injury when I was young one time, and every breath hurt, every breath. And going through and then winding some of those muscles can not just reduce some of the pain and irritation, but it can improve your inhalation, exhalation. It can improve your breathing. And so let's have you try what we talked about first, and then if that doesn't resolve it, then we'll try something different. But after that, we'll go through and do a thing about opening up your rib cage.
Okay.
Like the whole rib cage. Let's just top to bottom.
Okay.
Yeah.
Great.
Yeah, it feels good. Like I do it on myself from like maybe once a year or something.
Mhm.
But when I was younger, I used to do it a lot. But now, about once a year.
Okay. Well, thank you very much.
Yeah, you're so welcome. Keep us posted. Like try that, and then if you need some substitutes or something, let us know. But like try that, and then if it's not resolving it, then we'll try a little bit of a different approach. But
Okay.
that should start to do something there.
That would be great. After 20 years. That would be wonderful. Okay, thanks so much.
You're so welcome.